The topic for this week is Lipid-Related Diseases, Type I Hyperlipidemia. The enzyme that deficient in Type I Hyperlipidemia is lipoprotein lipase, LPL.
What is the reason for the enzyme deficiency? The enzyme deficiency is lipoprotein lipase deficiency due to a deficiency of lipoprotein lipase, LPL, or altered apolipoprotein. As a result of this deficiency, the concentration of which molecule does increase. As a result of this deficiency, you will be having elevated chylomicrons, the particles that transfer fatty acids from the digestive tract to the liver.
As for the symptoms, hyperlipidemia doesn't cause any symptoms. The condition is only diagnosed by routine blood tests recommended every 5 years for adults. Hyperlipidemia is a hidden or silent risk factor because it doesn't carry any symptoms. It is considered as a hidden risk factor for cardiovascular diseases due to the fact that high concentration of low density lipoprotein and low concentration of high density lipoprotein are strongly associated with cardiovascular disease because they promote atheroma formation in arteries. They can also lead to a myocardial infarction, stroke, and peripheral vascular disease.
Is this disease age or gender specific? Although hyperlipidemia is not specific of any demographic that follows a Western diet, it's more common in men. Additional risk factors include family history, diet high in total fat, saturated fat, and cholesterol, diabetes mellitus and metabolic syndrome, chronic renal failure, nephrotic syndrome, hypothyroidism, hypopituitarism, obesity, physical inactivity, alcoholism, steroid use, oral contraceptives, and smoking. How would you diagnose this disease? The patient's medical and lifestyle history must be taken into account when assessing the lipid profile. The patient should be in a steady state, medication should be noted, and improvement of conditions that lead to hyperlipidemia may also improve the lipid profile. For laboratory testing, the patient must fast for at least 12 hours before blood sampling, because chylomicron clearance can take up to 10 hours. Laboratory testing of lipid profile measures total plasma cholesterol, HDL, and triglycerides directly. Recommended results are: for total cholesterol concentration, it should be below 200 milligrams per deciliter. For HDL concentration, it should be 60 milligrams per deciliter or higher. For triglyceride concentration, it should be less than 150 milligrams per deciliter. Now, if the results are abnormal, then we can diagnose for hyperlipidemia.
Is this disease preventable? No, type I hyperlipidemia is not preventable because it is an inherited disease. What is the treatment for this disease? There are medical and non-medical treatments or therapies for this disease. One very popular medical treatment includes the use of statins, which function by competitively inhibiting the HMG-CoA reductase, which is an enzyme that is the primary rate-limiting enzyme of the cholesterol biosynthetic pathway. This competitive inhibition slows the rate of the mevalonate production, and that is the next molecule in the serial steps to produce cholesterol. Some popular non-medical therapies include exercising, quitting smoking, as well as modifying the diet, specifically lowering intake of animal products and increasing the intake of plant-based foods.